And our final guest for tonight is Mr. Dwayne Reynolds. Mr. Reynolds is the founder and CEO of Just Health Collective, but that's what he's doing now. So he has had a long career in terms of creating diversity and inclusion in hospital systems and medical practices and medical systems. And he's like, you know what? I've been doing it for other people so long. I'm gonna do it for myself. And he started Just Health Collective. So welcome to the program, Mr. Reynolds. And we'll start you off by saying, what is Just Health Collective and what is your primary reason for being in business?
Well, thank you so much, Ellis, for inviting me to be on. I'm really excited to be amongst this esteemed group of experts that you have invited. So I'll start by talking a little bit about Just Health Collective. We are a consulting and advisory services firm that helps health and healthcare organizations advance health equity and belonging. And by belonging, I mean the intersection of diversity, equity, and inclusion. So our goal is really to partner with organizations to assess their current state, to make recommendations, and then support them in their transformation through education, change management, identification and mitigation of health disparities, and then building in the structures to really drive accountability for change.
Well, that sounds really good and really important work, because I know we're smiling and we're laughing, but that work is much needed, as we talked about earlier with Dr. Gigi. So I'm going to pose the same question to you recently about what Dr. Fauci's comments. And he's talked about the pandemic has exposed the undeniable effects of racism in healthcare. And that's a powerful statement from one of the top medical professionals in the country. Do you agree with this? And can you point to some examples?
Yeah, I absolutely agree with what he has said. And I think, you know, for us as Black folks, we certainly have recognized that systemic racism has been prevalent because we live it day in and day out. So it's not that he's told us anything new or novel, but the difference today is that fair-minded white Americans are really more aware and willing to call it for what it is. And so that actually gives me a lot of hope and optimism, because when people like Dr. Fauci start to speak out about these injustices, about the impact of systemic racism on health inequity, then we can begin to actually change the system. And so I'm cautiously optimistic, knowing how challenging this type of work is, knowing that it is not about one person or one entity, but really about a system of laws, regulations, policies, rules, individual behavior, institutional policies that ultimately are going to need to be evaluated, deconstructed, and put back together to create a more just and equitable system. So, you know, I've been working in the healthcare space, as you mentioned, for quite some time, over 20 years now, and been an expert in health equity for probably about 8 years or so. And I think it's really important to understand that racism functions at both an individual level, an institutional level, and then a systemic level, which has to do with the policies and laws and history of racism in our country. And so we have to work at all three of those levels in order to really deconstruct the system that has marginalized different populations. And when I think about health equity broadly, it's not just about race as a factor, but about language, about sexual orientation and the marginalization of the LGBTQ community, about access. It's about many things. So it's sometimes a daunting task to think about how to solve for health equity. But I, again, am very cautiously optimistic that we can begin to do better.
So those numbers that we talked about in North Carolina and Georgia, and we've seen it all throughout the Southeast, do you think that kind of the South's history with regards to how it's treated its minority communities has played a role in kind of the distrust of the messaging regarding the vaccine?
Oh, absolutely. I mean, if we look at a map of the country and think about the areas that have the worst outcomes, health outcomes, we're usually talking about the South. And that has to do with the history of the South and the continued sort of institutionalization of racism. And it can play out in very covert ways that are still having impact. So for instance, when we don't have Medicaid expansion, that has a major impact on communities of color. When we aren't properly allocating funding or creating laws that may actually impact one's ability to access healthcare, that creates health disparity. So I think the South has a way to go in terms of really the political determinants of health and how we think about our politics changing and the involvement of marginalized communities in politics. And we know here in Georgia, that voter suppression is a real thing. Well, that has major impact on our ability to create policies and vote for policies that are to our advantage.
Amen. Well, the last question I'm going to ask you, and we'll bring everybody else back. You previously served as president and CEO of the American Hospital Association's Institute for Diversity and Health Equity. That's a big sounding title there. What are some of the best practices of hospitals you saw across the country with regard to creating health equity?
I appreciate that question because these are going to be important things for folks in marginalized communities that suffer health disparities to recognize and think about as you interact with the healthcare system. So first, it's critically important to know and see that healthcare organizations are collecting race, ethnicity, language, sexual orientation, gender identity, and social needs data. That is a baseline for understanding disparities that might exist. And so if organizations aren't collecting that type of information, then they likely aren't doing anything with regard to performance improvement around it. The next thing I'd suggest is community partnerships. The hospital alone cannot solve health inequity. There has to be partnerships with community-based organizations, government entities, other corporate organizations. Then we've heard a little bit about training earlier on in the discussion. So training around unconscious bias, anti-racism, cultural humility are really important things for healthcare organizations to be doing. And then finally, I would say increasing clinician and leadership diversity on the clinician side, recognizing that there tends to be concordance, which means that patients may follow your care protocols more easily. They may be more open and trusting in conversations. And then leadership diversity means that we have the right representation at those tables for strategic decision-making and resource allocation.
Well, amen to all of that. And I'm with you on that because I just as an aside, I went and got certified as a D&I diversity and inclusion specialist because I definitely am passionate about the work, and so I appreciate what you're doing, and glad you were able to come on this evening with us. So I'm going to bring back Dr. White and Dr. Gigi as we're wrapping up this program. We've only got a few moments here, but I know there was a question. What is in the vaccine? That's the big question. What is in the vaccine? We get that question a lot. So Dr. White, Dr. Gigi, you want to take that?
So as we talked about earlier, the mRNA is a protein. Remember that the COVID is like a spiky ball. So the part of the virus that allows it to infect us is that spike protein. So it's basically a copy of the spike protein, not the actual COVID, but a copy that trains our bodies to make antibodies to it. And as soon as we start to get trained, then it disappears, just like on Mission Impossible, gone.
Right. And it's wrapped in a lipid nano something or other that
it's wrapped in a fat particle.
There it is.
Of course, fat dissolves, and so that all goes away. Yes. Oh, and I wanted to mention one thing I forgot that's very important. They've identified the preservative in the Johnson & Johnson that's causing the blood clots. So
Oh,
that's
wow.
a very important thing. So
great.
they'll probably be able to take that out.
Kumiko, the entire the fat module, everything that gets shot into your arm, once your body starts learning how to fight it, it all dissolves and it gets passed through your normal processes of your day. I'm not going to get too graphic on that, but it gets passed out of the body once it starts get your body starts finding out and copying and figuring out how to fight that copy of the crown. Well, this is
Can I just add one thing? And I'm sorry, I don't mean to hog
Sure.
up the time. For some of these models that we're talking about in terms of getting people vaccinated, I'd really like to call everybody's attention to the Black Coalition Against COVID's Racial Equity Handbook, because a lot of the different initiatives, including ours, are listed as exemplars, which is really a how-to book to get more guide anyway, to get more and more people vaccinated. Lots of great information.
Yes. Another way also to get more information, if people actually have internet access, would be the CDC.gov. They have the vaccine finder. You can actually call your local pharmacy. So for those who don't have internet access, call your CVS pharmacy, call your Walgreens, call Walmart. A lot of times you're able to call and get more information. And usually the message actually on the phone will tell you whether or not that particular location is providing vaccinations. And don't forget about your local churches. We have the Church of Berean Christian Church here has become a vaccine site. That's another way that we're really trying to reach the community, is by using a lot of the community leaders at places of worship. So make sure that you utilize those resources within your local community also for additional support.
Shout out to Temple of Praise, which has vaccinated 4,600 people. They
Amazing.
vaccinate 3 times a week.
Wonderful.
Well,
Hey, Ellis?
Yes, sir.
I have a quick question, just because I have 2 doctors here. So I've been trying to convince, members of my family, my cousin in particular. She has had COVID, and her worry or question is, does she need the vaccine even because she's had COVID and perhaps has antibodies now?
Yes. And actually, because the antibodies that are made as a result of infection, that response is not as robust as with the vaccine, number one. Number two, there's actually some data that with the long COVID, long haulers, 30% of them might actually get better when they get vaccinated.
That's great.
The answer is yes, absolutely.
Okay.
Yes.
Well,
and there's a synergy.
Yeah, and there's 2 doctors who validated that you need to get the vaccine.
Because there's a synergistic effect if you've had the actual illness, right? The antibodies, and you get the vaccine, that you actually have a boosted immune response. So
Excellent. Thank you.
Amen to that. So as we're wrapping up here, I wanted to say thank you to all of my guests. I want to say thank you to Valerie. We're coming. I'm sorry y'all didn't get a chance to do your Delta thing there, Candace, but Valerie Murdoch from North Carolina. I want to thank Dwayne Reynolds. I want to thank Dr. Candace White, and of course, always Dr. Gigi, most gracious Dr. Gigi, for participating in this discussion this evening. It has been wonderful. As we've talked about COVID and the vaccines, but we've talked about it, I think, from a holistic standpoint with regards to what government agencies are doing, what private entities are doing in terms of eradicating health disparities. And we've talked about the vaccine. We talked a little bit about mothers. So we're going to talk about that some more, Candace. We're going to have you back and we'll have you on Dr. Gigi's show when Dr. G and I
I would love to come back.
We will have you on House Calls with Dr. G. I just threw that out there, Dr. G.
Absolutely. How's the baby? You didn't tell us how the baby's doing.
Wonderful. So she's 1 year old, and that was when we actually did the book launch to celebrate life.
Oh,
amen. So people, there's good news about COVID. I just want to let y'all know that it's not all doom and gloom. I saw some of those comments of people saying we're fear mongering. No, you're telling the truth. And I think as medical professionals and as a site, we have to tell you all we have to be most cautious, right? Because we want to give you information that's going to be the most safe for you and your family. So hopefully we've helped add it to your body of knowledge so you can make a good, an informed decision for you and your family this evening. If you you want to reach out to any of these organizations or associations, these people, please let us know and we'll get you in contact with them. If you're in Atlanta, go see Dr. White. She is great. She's right there at the cab. So you know she's right there in the middle of our community here in Atlanta. If you're a hospital and you need some help with the equity, go talk to my man, Dwayne. He will take care of you. And of course, if you need to know anything about what the Black Coalition Against COVID is doing, especially in the DC area, but around the nation, you can talk to Dr. Gigi. So again, thank you all for joining us tonight. Hopefully we answered some of your questions, and we look forward to seeing you again soon.
Thank you.
Thank you.
Bye.
Bye.
Thank you.